So tonight, some experts are raising concerns saying that COVID hotspots emerging could lead to new problems this winter.
So here to address that and answer your questions is Dr. Todd Ellerin tonight. He's Chief of Infectious Diseases at South Shore Health. Dr. T, it's great to see you as always. So here we are, right? The temperatures are dropping, the time changes come, so it gets darker early. We're going to move inside. How concerned are you as we move our lives more indoors again?
Eddie, I really am concerned as we close the windows and we know that this virus spreads more indoors. I'm most concerned about those who are unvaccinated and then those who are elderly or who are immunocompromised or have comorbidities who haven't received their boosters. Those two groups are the ones that I'm most concerned about.
Doctor, thanks for joining us. As always, we always appreciate your insight. Some states are heading back into the trouble territory, which is what Ed just said. Let's talk about Michigan. Mask wearing there has declined to about 25% of people, according to several recent surveys. So we might be more careful here, but a lot of people are out traveling again. So in your opinion, how safe is it to go to potential hotspots?
So Maria, let's face it, with the very contagious Delta mutation, with low vaccination rates, we're still under 60% for the United States overall. With pandemic fatigue, like you just said, there's less masking. And with increased mobility, more traveling, that's all a recipe that will enable COVID-19 to go viral this winter.
All right, Dr. T, just a few minutes ago, you talked about vaccinations. So let's focus in on that. First shots are now averaging about 300,000 a day. That includes kids between 5 and 11. So are you encouraged or discouraged by that rate?
So Ed, remember, there are about 28 million kids aged 5 to 11. We've had about 1 million kids vaccinated so far. That's good. But at the pace of 300,000 a day, that's about 2 million a week. It's still a little slow. I'd love to see that number doubled if possible. I urge parents to bring their kids in as quickly as possible because we are expecting a surge, if not now, very soon.
So if they have questions, your advice is what? Because obviously, if the numbers are not up, there are a lot of parents who have questions. What do you ask them to do? Go to the internet, call their doctor? What's the best advice you can give them?
I think the best advice for parents is really to talk to your kid's pediatrician. But I have to imagine that most pediatricians in the country are going to recommend that your kids roll up their sleeves and get the vaccine. They're that powerful, and they could make the difference between getting sick this winter, spreading it to someone who's vulnerable within the home, saving your child from that multi-system inflammatory syndrome. But there are lots of other resources as well. I think most of the good resources point to the same thing, and the answer is please vaccinate.
With Thanksgiving 2 weeks from Thursday, 2 weeks from today, it's a great reminder, Dr. T. Thank you. Great to see you.
Thanks,
as always.
Doctor. Be well.
Thank you, guys.